The youth make up a significant percentage of the world population. Adolescents, aged 10 to 19, reportedly make up a 1/6 of the entire world population. Adolescence is a period noted for its rapid physical, mental, biological, and psychosocial development. It is also a period of great exposure and vulnerability to dangers, including injuries, violence, and diseases, including HIV/AIDS. The human immunodeficiency virus, HIV, has become all too well known in the world all over, with a starker reality in Africa. According to the WHO, 90% of the world's HIV-positive adolescents live in Africa. Even though there has been significant progress towards halting the spread of HIV, adolescents still account for 10% of all new adult infections, and recent testing coverage suggests that many adolescents are unaware of their HIV status. Achieving viral suppression among adolescents, young men and women has been one of the greatest challenges in the control of the HIV/AIDS epidemic in Nigeria, the most populous African country and one of the countries with the largest population of young people in the sub-Sahara region. In general, hygiene is one of the least considered issues when designing programs and initiatives to increase HIV viral load suppression, especially among young people. However, it does play an important role. In recognition of this unique gap, Agbymw Public Health Initiatives, with funding from the U.S. Center for Disease Control and Prevention, CDC, teamed up with Foundation for Resilient Empowerment and Development, FRED, to implement the Special Adolescent Girls, Boys, Young Men and Women Project, AGBYMW, funded by the CDC.
The Adolescent Girls, Boys, Young Men and Women Project in Benue State is an aspect of the ICARES OVC project implemented by Agbymw Public Health Initiative. The project, which is sponsored by the CDC America, is intended to provide a comprehensive package of care for adolescents towards mitigating the prevalence and the scourge of HIV among the adolescent population and the population of Benue State in general. The project has three basic objectives. First, to provide safe spaces where adolescents can be provided with livelihood support and sexual and reproductive health education. Second, to adopt a comprehensive package of care similar to that of DREAMS. And thirdly, to provide an avenue where adolescents can be supported with livelihoods so as to build their leadership skills and qualities towards becoming better adults in the communities. By the beginning of FY21, the Foundation for Resilient Empowerment and Development, FRED, was sub-awarded by Agbymw Public Health Initiative to champion the adolescent programming on the ICARES OVC project in Benue State. Part of FRED's mandate was, one, to mentor and monitor the activities of HCSOs providing support to adolescents in different locations, especially for 3 local governments in the state. Secondly, to design questionnaires for eligibility assessment of 4,000 adolescents who would participate on the adolescent program. And thirdly, to provide support to CSOs for the creation of safe spaces in the communities where livelihood support and treatment literacy, as well as sexual and reproductive health messages, will be provided to adolescents. And fourth, FRED also had the mandate to ensure the provision of other safe spaces where livelihood support for adolescents, such as enrollment into vocational skills and training, as well as provision of startup kits to a number of adolescents, can be feasible.
After much research, planning, organizing and strategizing. The destination was set for Benue State.
Research has shown that Benue State is one of the states with the highest HIV prevalence in the country, and Agbymw saw it necessary to implement adolescent girls, boys, young men and women projects in Benue State in order to reduce the spread of HIV amongst adolescents in Benue State.
The strategy for the Agbymw initiative was developed by technical experts with years of experience in HIV/AIDS programming, WASH, adolescent sexual and reproductive health, and other relevant thematic areas. After several engagements and support from relevant stakeholders, including the Benue State Government, Benue State Agency for Control of AIDS, Benue State Ministry of Health, the project was introduced into the state and work began in earnest.
The people of Benue State have proven their good hospitality, as I've heard in stories, most especially where the Agbymw program has been implemented. Talking about Makurdi, Taka and Boko, the Agbymw project was not an exception of this good hospitality, this good reception. There has been a smooth implementation of this project due to the welcoming of this project in the state. At the beginning of the project, Fred conducted advocacy visits to relevant stakeholders at the state level, at the local, and in the communities. Fred paid an advocacy visit to the Benue State Action Committee on AIDS. Fred equally paid an advocacy visit to the State Ministry of Women Affairs and also the OVC desk officers, the focal persons at the Social Welfare Department of the local government. We equally paid advocacy visits to traditional rulers across different communities of implementation in the 3 local governments where the project was implemented.
The first issue to tackle was identification of gaps in implementation of adolescent program by CSOs.
Riding on the mandate provided by Agbymw Public Health Initiative, Fred moved to Benue State in January and swung into action immediately. The activities which were carried out on the project include, first, mentoring of adolescent focal persons and the CSO volunteers on implementing and delivering life skills support in cohort sessions. Secondly, provision of livelihood opportunities to 30 adolescents, ensuring that they become independent and self-reliant in their adulthood. Another activity was the delivery of ART treatment literacy to adolescents living with HIV and ensuring that they are virally suppressed through consistent adherence counseling. We also provided menstrual and sexual reproductive health education, as well as some mentorship to some adolescents within the community cohort sessions, as well as the OTZ, which is a facility cohort sessions, and ensuring that there is a better outcome of their treatment and as well as their menstrual health.
However, implementing any strategy, even one well thought out, as the Agbymw initiative, is not without its challenges.
Like every other project, we also have challenges implementing Agbymw projects in Benue State. Some of the challenges are lack of SOPs. By way of addressing, we have adopted some Christian aid manuals and developed some local tools. I also have poor capacity among focal persons at CSO level. By way of addressing, we normally hold bi-monthly refresher trainings with these adolescent focal persons. We also have poor documentary. In order to address this, during our bi-monthly refresher training, we review our reporting tools with them in order to have a perfect report or documentary at the end of the projects. Another challenge is a poor commitment of some stakeholders. In order to address this, we have paid advocacies to communities, we have host CPC meetings, strengthening the systems to have a better projects.
In spite of these challenges, Agbymw and Fred were able to achieve great results at the end of the 10-month project.
I would actually describe the adolescent project by Fred through Agbymw as very successful as a result of the continuous mentoring of the adolescent focal persons at the CSO level and the various activities conducted to support adolescents at the facilities and the communities. And we are actually appreciative of that. We're encouraging APIN, Fred to keep it up.
Foundation for Resilience, Empowerment and Development, in collaboration with APIN Public Health Initiative, has recorded tremendous successes on the Agbymw project. Some of the key highlights or successes recorded on the project were as follows. So at the beginning, we actually built the capacity of the adolescent focal persons to carry out effectively the adolescent program. We strengthened the child protection committees in the communities, where we brought together the CPC members and strengthened the engagement of the CPC.
Before Fred came on board, we were working with the adolescents, but we lacked capacity on how to embrace them. Until Fred came on board and built our capacity, they work with us in the community to ensure that the adolescents are impacted with full knowledge on how to make informed decisions about their health and their well-being. So I really appreciate the presence of Fred, and I look forward to work with them in the next FY.
We provided comprehensive adolescent services to 4,078 adolescents. Initially, when we came on the project, we had a total number of 52 adolescent cohorts, both facility and the community cohorts. Right now, we have a total of 132 adolescent cohorts which have been formed, inclusive of the OTZ and the community adolescent sessions.
Young Zende, Murnika Danda, Nagunum, Tuhaqua, Zende, but I call Vivanegama do Mahamoga, with a Yilam Viva Wanka training. Again, back with Tremo, Muzan, section, Banzane, Muneka Himi, Mfanis and one for decision making, for interfriendship. Mfa solving problem akane chia mfa higen na ha msu accord msu epid msu CPC mashi Fred msa no de mebelu ya unelu ya anabeta ha msu bechisha ko hue itombo wa matio ya chi ne wane de san ha motiga aza han gba no gane pa msu ne chi.
In the course of the project, we were able to identify and profile 30 adolescents. We enroll them in 6 different vocations where they are learning. We have provided startup kit for the 30 adolescents that were enrolled on different vocational skills.
I was dropped out of school after my primary school before I met a volunteer from IHP that introduced me to the CPC, APIN and Fred program, and I was enrolled into training, baking and confectionaries. And now I'm a professional baker from Imperial Pastries and Cake. I can now bake cakes, meat pies, samosa, spring roll, etc. I want to sincerely thank CDC, APIN and Fred for changing my life. They've changed my situation. I did not know I would further my education, but I want to thank them because they've enrolled me into training, and now with this baking I can further my education. And I want to also encourage them to also train adolescents like me in my community.
We have also facilitated the creation of Adolescent Youth-Friendly Center in Boko, where 40 adolescents have been enrolled in different skills. The Youth-Friendly Center has also provided an avenue where adolescents who are even not on the program come for sessions of life skills support, where they are supported in different life skills to be able to become responsible adolescents.
As an adolescent, I acquired so many skills during the behavior change section. I was a bad boy. Through the advice of bad friends, I construct and ask for bad activities. With the help of the section, I'm now an obedient child to my parents. I abstain from sex, from night keeping, smoking and drinking alcohol. I abstain from following bad friends. Thank you, Accord, Fred, APIN and CDs for doing this to me and my community.
We've also reached out to 1,500 adolescent girls on menstrual hygiene messages. We've also reached out to 40 adolescent boys where we provided 40 boxers to them to improve or imbibe in them a good personal hygiene practice.
Before now, my scheme of menstrual hygiene was very low, but with the help of Fred Menstrual Hygiene, it has taught me and my colleagues a lot more on how to take care of ourselves and to prepare ourselves when we are on the period of menstrual hygiene. I want to thank Agbymw, Fred, CDC, Boko Diocese for helping us to know more about menstrual hygiene and how to take care of ourselves more and better for future. I want to appreciate and tell them to create more opportunities and skills to my other colleagues that have not yet benefits.
Also, we provided treatment literacy to 1,675 adolescents during OTZ sessions. This helped improve the treatment outcome of adolescents.
Beneficiary of OTZ activity, and it has really helped me a lot because before then my viral load was very high, 16,000 plus, and now I'm virally suppressed on a 0, and I'm also an OTZ champion. I also appreciate CDC, Agbymw, and Fred so much for all they have been throughout the meeting, their sponsorship and everything. I want to say a big thank you and also encourage more adolescents to attend this meeting. Thank you so much.
Okay, Chief Agbymw Dana, ka community Agbymw, da yin igboko. Mba na higene be klalo Agbymw. Welu ko ni yolobe be kelen ko be yolobe be fa itawru zona ko aya. Na be kla yemu da yin shin koran yo wan yo shin manu chimbinga. Abeli ji mo sha ji le bulu le tiomla zona ko aya yolobe. Aka zigo ko dido ne da be me. Uso CDC Agbymw my Fred kushi shabana bia program na hitawa. Okamo amba ya ko na shabe program na sha zona ko aya.
There is still much work to be done to consolidate and sustain the successes from the project. Currently, Fred and Agbymw are working to strengthen the capacity of the CSOs, youth cohorts, and partner organizations.
The adolescent project implemented in Benue State in the FY21 was just in its pilot phase. So there are a lot of room for improvement. On the project, we feel the area of expanding the scope to include Adolescent Plus, which includes older adolescents and those who are pregnant, can be taken into cognizance in the subsequent years of implementation. During implementation, the scope was mainly focused on adolescents between 10 to 17 who are on the CSO's NAMIs. And so we feel that the scope can be extended so that we can collaborate more with the facilities and not just with the CSOs. Another area that can also be improved on is the issue of competing responsibilities, and which Agbymw has given Fred a mandate to employ more staff to cover all the CSOs in implementing local government areas.
Agbymw, on its own part, plans to ensure that adolescents and young people in Benue State are supported and empowered to make conscious, quality decisions regarding their health.
As we wrap up the pilot phase on the Adolescent Girls, Boys, Young Men and Women project, we want to at this point extend our gratitude to CDC, to Agbymw Public Health Initiative for their tremendous support throughout the implementation of this project. It is our hope that if this project is scaled up to other LGAs, we will reach out to more adolescents, we'll create more cohorts, we'll create more livelihood opportunities for adolescents who are vulnerable. Empowerment of adolescents is indispensable for achievements of the full dividends of the Sustainable Development Goals.
Not all heroes, they say, wear capes. We are confident that with organizations like Agbymw and Fred passionately strengthening access to HIV/AIDS care for adolescents in Benue, it is only a matter of time before adolescents living with HIV all over Nigeria and the world at large can have unhindered access to quality care, and before HIV/AIDS is eradicated from our world for good.